Good morning, students. Myself, Dr. Ganesham Chavan. Today, we are going to discuss the new topic of which is called as Code of Pharmacies. In this, we will discuss the various codes. Okay. First of all, we must know what is the ethics. In each profession, there are certain ethics, and if we will work with the ethics, our work will be very honest. Our work will be very great. And suppose if we will live ethics, so it will be unethical, it will be not logical, and you are cheating with your profession. It is nothing but the ethics. So in each work, in each type of profession, it may be pharmacy, it may be doctor, it may be engineer, it may be professor, it may be any prosecution means justice. So in any field, if you are doing your work very honestly, if you are carrying your ethics in your works, so it will be good for our society. Means no any discrimination will occur if you will do your work properly with proper ethics. Sometimes due to greediness, due to human behavior, we may keep side ethics, and for grabbing or for getting money, for getting more benefits, we can compromise with our ethics. It may happen. So that's why there are certain ethics which has been listed by the our authority for community pharmacists, that pharmacists must follow such ethics. Ethics are not actually rules. Ethics are nothing but the unwritten rules, or there is not exact any prosecution, there is not exact any authentic legislative rules. Ethics are nothing but the when your profession is not allowed to do that, it is called ethics. So if you will do your work proper ethics, you won't, you will do justice with your work, you won't do any malpractice, you won't do any wrong behaviors which can spoil your image, which can spoil your profession. Because our pharmacy profession is one of the profession which deals with the life of peoples. We can save peoples, we can save patients, and if we will do compromise with our ethics, definitely it can take life of patients, and it is very very problematic. Introduction. A profession is identified by the willingness of the individual practitioners to comply with ethical and professional standards. There are certain standards which has been set for ethics, and we need to be match up our levels with that standards. We should not degrade our standards which exceeds minimum legal requirements. So there are also certain legal matchup with that, some legal points, some ethical points. When you are violating some legal rules, sometimes it also violating our ethics. So they are going with one by one or other. So they are parallel things, legal things and ethical things. So we should go with the same way. We should keep both the things at normal level. We should not break any rules. The pharmacist continues to be the health professional who is the expert on medicines. Pharmacist continues to be health professionals because pharmacist is having a huge knowledge of medicines. He having good knowledge of health, good knowledge of disease. So he must able to express his knowledge towards the community, and he must try to uplift the health level of the community. So he is one of the health professional and who is expert in medicines. Pharmacists are also given the responsibility to help people to maintain good health. As I told recently, pharmacists are having sufficient knowledge of medicine, so he can maintain the good health. He can priorly intimate to the peoples so that they should not become patients. He can properly tell to the patient that how they have to maintain their healthy daily life, what foods they should take, what foods they should intake into their balanced diet, and what things they should avoid, what should be their daily patterns. So such type of things he can provide that information, he can suggest this information towards the general people, towards the patients, to avoid ill health, because precaution is better than cure. So you have to avoid the ill health. If you will avoid, there is no need to take in medicine, because sometimes medicine can itself create a problem. They can create adverse drug reactions, drug interactions. As we know, there are number of people are losing their life by drug interaction, by wrong drug, or by the long-term use of drugs. It may produce the chronic side effects, it may produce the adverse drug reactions. So these are the various points, these are the various reasons by which the drugs are also taking life of human being. So that's why we have to take these drugs very precautionary. Otherwise, we should avoid to take these drugs. We should precautionally, we should live in such a way that there should not be any illness into your body. And also, they can promote rational use of medicine. We should use the drugs very properly. What drugs we should require, only that only you should take. Don't take unnecessary drugs, don't take OTC drugs, over the counter drugs. Whether they are required and what how much quantity they are required, only that much we have to take, and gain maximum therapeutic benefit from their benefits. Means whatever drug you are taking, or in what amount the drug you are taking, we have to get the maximum effect of that drug into the human being according to the disease, their severity, their concentration. Accordingly we should take the drug and their dosage forms. The code deals with the ethics rather than the laws governing pharmacy practice, because not always the laws will tell you that you have to do this thing or not. Sometimes ethics you have to carry forward, and ethics are not always deals with your laws. Sometimes whatever practice you are doing, it will be right according to the law, but it may be wrong according to the ethics. So we have to keep one eye on ethics and another eye on laws, legislation. The code benefits, defines, and seeks to clarify the obligation. What is obligation? Our responsibilities, what we can do in our profession, our work, of obligation of pharmacists to use their own knowledge and skills for benefit of others. Pharmacists always use their own knowledge, their whole knowledge, their experience, their educations, what they learn into graduation, what they learn during their practice. So pharmacists must use this knowledge for the benefit of the people. That is its first priority. So he should also earn money, but his first priority will be to do the service of people, to do the service of the common people, common civilizations, to maintain their health, to protect their health from the various things, from the various diseases, various conditions, various pandemics, to minimize the harm. Suppose if some persons are already having kidney stone problem, and if that person is taking, if that person is taking raw tomato or he's taking brinjal, if pharmacist having that knowledge, he can tell this knowledge to that person, that ultimately it will worsen the condition, that seeds of tomato, that seeds of brinjals may affect or may increase the problem of our kidney stone. So these type of things, this type of knowledge, they can transfer towards the general public or towards the patients, so that their harmful effects will not increase. So, like that, it is a role of pharmacist. These are nothing but the obligation of the pharmacist, which he should follow, and it never comes in case of rules. It comes in ethics. He must follow the ethics. Now, in case of drugs, if there are some drugs which are from a Schedule A drug, or the drugs which are coming from the narcotic and psychotropic drugs, so these drugs pharmacists must give only under the supervision of physician, and only by the prescriptions. Whenever he will receive any prescription, on that basis he must give the drugs. I saw certain examples. Few years back, there was one cup syrup, Corex. It contained codeine phosphate, and due to that codeine sulfate was there, I think, and it is habit forming drug. So lots of times the peoples are asking medical store to give that drug, and they was giving because it is not comes under the category of schedule X drug, and due to which it becomes the habit forming, and lots of consumption has been occurred of that Corex. So that's why government have banned that typical brand, and after that they are asking the prescriptions for that codeine containing drugs. So such type of unethical things may occur. So it is called, when you are when you are doing the breach of obligation of ethics, when you are breaking the ethics, means you are giving that drug unethically. You are not giving that drug for therapeutic purpose. You are giving that drug for only for enjoyment, only for habitual purpose, only for to use it for your enjoyment. So what is your primary goal of pharmacist? To maintain the health, to work as a health professional. We are the health professional. So here we are having this point, to respect the patient autonomy, and to provide the fair and just pharmacy care for their patients. Next point is, for those entering the profession, the code identifies the basic moral commitments of the pharmacy care and serves as a source for education and reflections. So we must identify what are our basic moral commitments, what commitment we have made for our profession, whether we are following that commitment or not. So there are basic moral values that we should keep in case of this profession. No, we are also here for getting benefits, getting money, but there are also certain moral values. So we must keep that moral values with us. If you will keep them, then only we are able to do your work properly. Otherwise, it will become unethical. That's why we are here discussing the code of ethics. So code of conduct, how you are following that code, where you are following or not. So we must include that code of ethics into our work. Otherwise, it will become unethical, and it will also damage the health of society. So for its protection, we must have proper code of ethics. For those within the profession, the course serves as a basis for self-evaluation and peer review. It is very, very important. So we must evaluate ourselves whether we are providing proper service or not, whether we are following all the rules or not, whether we are following all the codes of ethics or not. If you are violating any rules, so we can check ourselves, and we can get the review from others also, review from the standard ones, review from the other experienced persons regarding us, whether we are doing our work properly or not, whether we are doing any mistakes, whether we are violating any rules. And if you are finding guilty in that, so we can change our way of working. We can clarify us, we can do correction into our work, we have to decrease that violation. So in this fashion we are upgrade our standard of work. For those outside the profession, the code provides public identification of the professional ethical expectations and its members. So the codes provides outside identification. So the peoples who are working from the outsides, so they must also work ethically. If they are not directly in contact with the pharmacy, if they are allied sources, and if they are doing malpractice of medicines, some peoples are means there are certain groups who are preparing the wrong medicine or adulterated medicines, or the medicine which has been banned. So such type of works they should not do. So they can check whether they are following the ethics or not, and if they are not following, so we can take action against them. Professional ethics are defined as rules of conduct, means how we are working, how we are behaving. Conduct or standards, means what standards we are set, whether we are following that rules or not. Standards by which a professional community regulates its actions and sets standards for its members. So it is a way of working when we are doing our work of health professional in society, in the community, and during that whether we are following these rules or not. And also our members are also following that rules or not. So it is nothing but the professional ethics. So when we are doing this healthcare profession, so in that we must follow all these rules, all the ethics, not only doctors but also the pharmacists, but also nurses, but also ward boy. Not only that, but also the co-workers, the other staffs who are working with them, all have to follow this, and they should not interfere with the work of others. Suppose if ward boy will start to do work of pharmacist, or he will doing malpractice, so like that he should not do that things. It may happen. Now, there are various elements of code. The code contains different elements designed to help the pharmacist in its interpretations. They establish correct dimensions for pharmacy practice. We must have the correct dimensions. We must design our codes properly. So these are the do's and these are don'ts. Means these things we can do and these things we can't do. So we must design our elements of codes properly, and we must always check ourselves. When we are doing that profession, we must check ourselves whether we are satisfying that tools or not. In the absence of conflict of ethics, the fact that a particular action promotes a value of pharmacy practice may be decisive in some specific instances. So when we are violating or we are not following any ethics, so in that whether we should check that, so whether it is going to be increase the value of pharmacy practice or not. If it is not increasing value of pharmacy practice, so we should not follow, or we should follow the proper rules of code of ethics. We should not, there should not be any absence of ethics rules. Obligation provides more specific direction for conduct. Obligations means our responsibilities, means that things we must do, we have to do in our profession. So obligations provides more specific directions, more typical work, more specific works which we have to do for conduct than do values. Obligations spell out what a value requires under particular circumstances. Means obligations will tell that what we have to do, how much you have to do, for how much period you have to stay into the hospital, you have to stay into the medical store, and how to handle that prescriptions, and how to talk with the patients, how to handle the patients, how we can increase the drug adherence. So like this, it is a code of conduct. So how we are conducting, our work. That is need to be discussed here. It also important to emphasize that even when a value of obligation must be limited, it nonetheless carries moral weight. So when we are having limited obligations value, means whatever the work, whatever the responsible work we are doing, it is having limited, but still we should try to maintain our moral values, try to maintain them. For example, a pharmacist who is compelled to testify in a court of law on confidential matters is still subject to the values and obligation of confidentiality. Sometimes pharmacists are compelled to testify the court of law, means if in any prosecution, in any legislative procedure, the pharmacist have to go into the court and he have to present any case, or he have to carry in information or tell in information, so he should be confidential with that matters. He should not disclose that information to the media or to the opposition party or any party. He should not do that. Otherwise, it can create the problem into the justice. It may create problems. As we are seeing, there are lots of cases which are going on, how the test has been done, or regarding PM, the PM report also not properly done by some physicians, or the PM reports can be changed, the, the change can be there, or some modification can be there into the PM report, exact date of time of that date, or how death occurs. So proper investigation should be there, and that investigational information also should keep confidential. That is very very important. But nowadays it becomes very malpractice, means peoples are selling those information in sake of money. For getting money, they are selling this information to the media or to the other authorities. So these things should never happen. This is also nothing but the unethical work which we are doing sometimes. So we should not do this fraud for getting money only. The pharmacist must only reveal that confidential information that is pertinent to the case at hand, and such revelation must take place within appropriate context. Yes, as I have discussed, the pharmacist must only reveal that confidential information to that pertinent to the case, means the related to the case, means that a typical person who is related to that case, he may be lawyer of that person or relative of that person, only up to that limit, only towards them he should tell that information. Otherwise he should not reveal that information to the public in public domain. So that's why his work to keep that confidentiality towards his party only. So this type of things may be there for getting money, or for to do malpractice. It can be there because we are living in a developing country like India. So here there is a huge involvement of corruption is still there, but we have to start from ourselves. We should not do corruption, and also we should not support this corruption, so that our country and our health system will be strong. Now, code of conduct. What is code of conduct, that we will discuss very shortly here. Statement which capture the philosophical concepts which form the foundation of the code of conduct. They are the statements which are expected to be resilient over the time. Now, what is code of ethics? It is the statement of which capture the philosophical concepts. There is philosophical concepts, means there is not actual legislative or any rules or any laws has been included. It is a philosophical concept. Means that depends on your philosophy, that depends on your thinking, that depends on your moral values, what you are thinking, what is right for you, what is wrong for you. Means ancient period by the ancient period, due to the influence of the god on us, so we are having two things, whether it is right or wrong, whether it is pure or impure, whether it is sin or it is good work. So like that, we are having the philosophy, and on that basis, if we are having good philosophy, if we are having good thinking regarding our profession, so that defines code of ethics. And if you are converting them into the statements, so we are converting them into some rules. So that is, and that rules, when you are following, it is nothing but the code of conduct. And when that code of conduct will not violate any rule of ethics, means it is a good code of ethics. And that typical bunch of rules is nothing but the code. And when that code, if you are following, it is called good conduct of code. Obligations are nothing but the responsibilities. We are your responsibles. There are two things: obligations and our or authorities, means what we can do and what we should do. So here, what we should do for the society, for our profession, so they are the obligations. These are the strict rules that we must follow to have a good code of ethics. That is more detailed statement to inform pharmacists of standards of profession behavior, and they just meet. So more detailed statement of inform pharmacist, and he should maintain the standard of professional behavior, and he should maintain that behavior. Means whatever whatever rules or whatever conduct is has been defined for as a normal professional pharmacist, so that person must behave like that. Means he should not do any discrimination between the two peoples according to their race, according to their color, according to their religion, according to their caste, according to their date of or place of birth. So like that, what is his rule or what is his obligation when the patient comes to him? So his duty is to give that typical drug at proper cost to that patient. And when you are not doing, it is nothing but the break of ethics, it is nothing but the breach of obligation. So when you are breaking any rules, it is called breach of obligations. So we should not break any rules. So our duty is to give the drugs, to dispense the drugs, to give the information, to give the proper information. Don't misguide to the patients, and also don't avoid the patients, and don't do any distinguish between the, or don't do any partiality into the patients. So because we are here to do a great job, to do a supreme job, to maintain the health of peoples. Next obligation is, although not underpinned by the legislation. What is underpinned? Means it is not supported, not having backbone of legislation. Although the ethics are not all the ethics are directly backbone or supported or having the uh, strong base by the legislation. A breach of obligation nothing but the breaking of rules, breaking of our responsibility, breaking of our duty when you are not doing duty. So breach of obligation, and by inferences could be expected to the basis for disciplinary actions. So here, sometimes, though there are some things which are not supported by the legislation, but still, if we are breaking them, so it can be comes under the in disciplinary actions. So we have to change it and we have to maintain the discipline. Means not all the ethics are comes, or not all the ethics are supported, or they are based on the rules. And we have to, there are certain things which ethics you have to maintain, and when you are not maintaining that ethics, it is nothing but the indisciplinary actions. So we have to maintain them, and we have to maintain by making it disciplinary actions. Now here are two sides for pharmacy. One side is law. There are several laws, for example, Drug and Cosmetic Act 1947. After that, Narcotic and Psychotropic Act. After that, the Clinical Act. So, like that, various acts are there, various rules are there which you need to be follow during your manufacturing, during their regulation of their content, means analytical. After that, their packaging. After that, they are prescribing. After that, they are dispensing. After that, their use. So like that, starting from the manufacturing till it goes into the body of the patients, there are various rules, various laws are there, and we must have knowledge of that laws, and we must follow that laws, and vice versa. And at the same time, in other hand, we are having ethics. There are certain ethics which are supported by the laws. When you are breaking the ethics, at the same time, law will also violate, and when the law will violate, you will get the punishment. You will get that typical punishment, or you will get, you will go behind bar also. So like that, laws, if you will break, definitely it will be called as, it will called as a breaking of laws, or it will called as offense of laws. But in case of ethics, ethics are nothing but the, they are beliefs, social beliefs, they are the philosophies, they are the moral values, and there are the duties that pharmacy must do this thing morally, ethically, and there are the obligations to work, to that performance, obligations to do that conduct, to do that work, to do that function. And if there is breach of obligation, will, if you are breaking that work, if you are not doing that work, if you are losing your ethics, means you are doing the breach of obligation. It is called as breach of obligations, and there is no any punishment, but it can spoil your image, it can spoil your reputation, it can spoil your weightage into the society, and ultimately it will decrease your business also. Once stigma will be there, once any stamp will be there on your profession, so nobody will pay attention towards here. So at the same time, ethics and laws, you have to balance between them, you have to keep both the things at balance level. So pharmacy is the only one profession where we have to balance both the things, we have to keep at the parallel levels both the things. Preambles. Pharmacists are health professionals who assist individuals in making the best use of medications, because pharmacy know all the aspects of the medicines, how you have to manufacture, how you have to use them, in which disease you have to use them, in what dose you have to use them, what are side effects, what are the toxic effects, what are the consequences which may occur after that. So pharmacist is having the huge knowledge of the medicines. This code prepared and supported by the pharmacist. Pharmacist will prepare and supported also by the pharmacist. Is intended to state publicly the principles that form the fundamental basis of the roles and responsibility of the pharmacist. The certain rules, certain principles has been prepared by the pharmacist and for the pharmacist to do the conduct of that obligation, conduct of that work. These principles based on the moral obligations, moral, philosophical, humanity based. humanity based obligations, humanity based works means what is the right account to our philosophy, account to our morality, account to our thinking. So these are the that obligations, moral obligations, and virtues are established to guide pharmacists in relationship with patients, health professionals, and society. So students, in this fashion, we have come across with the code of conduct of ethics in which the pharmacist must follow these rules. And in next lecture, we will continue this topic. So for today, it is sufficient. So we will stop today's lecture here and we will continue tomorrow the same topic. If you have any queries, you can put down your questions into the box, comment box, and do touch with me. And see you for today. Bye.